I love this question because this was exactly what we were going for. So this comes from a before and after post of a patient of mine that had direct to implant breast reconstruction. So direct to implant breast reconstruction is where we reconstruct the breast after a mastectomy. So there's nothing left. All there is skin and a little layer of fat. So the goal is to give the patient their breast back. And in this particular situation, the patient wanted a breast that looks similar to her pre-existing breast. So for patients having a mastectomy for cancer or for BRCA, the gene mutation that increases your risk of cancer, if we're reconstructing them with an implant, they have some decisions they can make. They can either want to look a little bit smaller, they can want to look the same, they can want to look larger, they can want to be lifted. And my goal is to get them as close as possible. So this particular patient had a breast reduction before, she was happy with her overall size, so the goal was to get her close to that. So here's a patient of mine that had a direct to implant breast reconstruction and wanted to be a little bit smaller. So you can see we can make you smaller with this surgery. Here's another patient that wanted to stay a similar size. Now, this is a good one because it kind of shows you what I was talking about. Although her volume is the same size, she wanted to be more lifted. And so the implants, because of their shape in particular, allowed her to have this shape versus her natural breast shape before her mastectomy. And here's an example of a patient that wanted to go larger. So she's got implants that are larger than what was removed with her mastectomy. So these surgeries are not breast augmentation. So people often look at befores and afters of breast cancer reconstructions and they expect to see a breast augmentation, but that's not what's going on here. This is not a woman with a natural breast who just had an implant put in. This is a woman who had a major oncologic surgery, and we reconstruct them in this situation with implants in one surgery. So there's lots of ways to do reconstruction, but this particular way is called direct to implant, and these are some examples. Let me know if you have any more questions.